Hello friends, I am Dr. Manan Gujarathi. I am an orthopedic surgeon working at Fortis Hospital, Kalyan, and I specialize in the surgical treatment of arthritic diseases, namely osteoarthritis. मैं orthopedic surgeon हूँ जो घुटना बदलने में specialist हूँ, fellowship training किया हूँ, and today we are going to talk about the when, the why and the how of knee replacements, common myths and misconceptions and trends about knee replacements. So what is knee replacement and why do we need to do it? See, we are born with a very healthy and a frictionless joint. We have the thigh bone, the leg bone, with a smooth articular cartilage covering them and menisci which acts like cushions between the joint movements. As time goes by, these smooth surfaces, they tend to become rough with wear and tear, with aging. If you come to us in this point in time, we will be able to make up on your x-rays, on your tests that you have early osteoarthritis. This is when we will advise you a lot of calcium medications, knee exercises, cartilage supplements. Based on your etiology, we may advise you certain anti-arthritic medications in order to stop from this happening. This is called as grade 3 or end stage arthritis. At end stage arthritis, as you can see, the joint surfaces, they have become very rough. There are bone spikes jutting out of the joint surfaces, the articulating surfaces. The menisci have become thin and torn and degenerate. A structural problem needs a structural solution. Beyond a certain point, medication alone may not be effective in reducing your knee joint pain. So what do? We will remove thin wafers of bone from the articular parts of your thigh bone, your leg bone, and when indicated, your kneecap, and we will replace them with certain low profile implants. Wafers of bone will be removed and replaced in the exact amount, and we'll put a spacer between the two bones, making sure that the ligaments are balanced, the movement is satisfactory, and that is called, in simple words, in a nutshell, as a knee replacement. So what are the myths? The first common myth is that joint replacement is an emergency. आज के आज भर्ती हो जाइए, कल ऑपरेशन करेंगे. It's an elective surgery. This surgery is to be done when all your blood parameters are normal, when all your comorbidities are under control, there is no ongoing infection in your body, and it's a surgery of choice. It's an elective surgery. We often remember Rajesh Khanna saying in Anand, "Zindagi badi honi chahiye, lambi nahi." So lambi zindagi to abhi has been achieved with all these medications that control diabetes and blood pressure well. We are there. Average life expectancy is in the 80s. We want to make it better. जो बड़ी है, जो लंबी है, उसको बड़ी करने में जो हमें सहायता देता है, that is knee replacement, and it is never an emergency. So what are the criteria that doctors like me see? Generally, जब मेरे पास patient आता है, I tell them at outset it's not an emergency. I see for 3 criteria. One is clinical and radiological evidence of disease. Second is the evidence of treatment. आपने ट्रीटमेंट लेके देखी है, आपने गोलियां खा के देखी है, वजन कम करके देखा है, एक्सरसाइज करके देखा. And the third and the most important is that the patient should demand and benefit from the surgery. पेशेंट को खुद ऐसे लगना चाहिए कि ये सर्जरी मुझे करवानी है और ये सर्जरी करने के लिए मैं तैयार हूँ. That is when we go for knee replacement surgery. So how do we do it? जब ये सर्जरी नहीं थी, when the surgery was new, the incisions were large, the implants were large, period of immobilization and dependence was large. These days, the surgeries are smaller, they are faster, the incisions are smaller, and the joints are replaced in a much lower bone cuts. Which is why we are able to make the patient, in most patients in the routine surgeries, we are able to make them walk within 24 hours of surgery. We are able to make them climb stairs in 2 days of surgery, and within a few days of surgery, the patient is able to go back to the comfort of his own home. This is made possible by fantastic pain control, preemptive strategies, and so on. Moving on, so what is the most common myth these days? Gold knee. What is gold knee? It is not gold. All that glitters is not gold. It is actually an implant coated with titanium and niobium, and it is indicated to be used only when the patient has an allergy to cobalt, chrome, and other such metals that go into making of the implant. So gold knee is not really good. Second common myth is, what is robotics? Will it make my surgery completely radically different? So robotics is sometimes called as an old wine in a new bottle because it will eliminate only the error in alignment and balancing which may not be there in most surgeries. So whether it technically makes the whole surgery new or whether it drastically improves the outcomes is not so. It has not conclusively been proven that robotics will alter the results in a knee replacement surgery. There are certain patients who will benefit from the use of robotics, but that does not include each and every patient. The third common misconception is custom-made implants, made to measure or made to order implants. These are fantastic. I have had the fortune of being washed up in surgeries that have used them in Seoul and in Germany. What I find is these implants are not routinely indicated. They are cost intensive. You need to undergo CT scans before you go for a custom-made implant. This implant generally gets imported, which is made according to your specific measures. It is without debate the fantastic implant, but it doesn't mean that each and every patient requires it. Simple words, किसी किसी को जो टेलर मेड कपड़े हैं वही फिट आते हैं, बट जनरल पॉपुलेशन को रेडीमेड जो फैक्ट्री मेड क्लोथ्स है they fit just as well. The same way, custom-made implants are indicated for very specific indications. Moving on, what is bloodless TKR, what is stitchless TKR, what is painless TKR? Bloodless TKR यानी ऐसा नहीं है कि आपके सर्जरी में ब्लड नहीं बहेगा. It doesn't mean that you will not have bleeding. In olden days, when the surgeries used to be very long, often the patient used to undergo a couple of blood transfusions during the surgery. Lately, with advanced techniques, quicker surgical times, we rarely have to transfuse the patient with blood. That is why it is called bloodless TKR. Stitchless TKR. See, you cannot make an omelette without breaking eggs. अगर आपको ऑपरेशन करना है तो टाका तो लगेगा. But the stitches that are applied in a stitchless TKR are applied within the skin, which is why you don't need to undergo the painful part of removing the stitches. That is why they are called stitchless TKR. But it's a misnomer. All surgeries of knee replacement done everywhere in the world will involve some or the other kind of suturing. And that is what is about stitchless TKR. Painless TKR. Again, no pain, no gain. Some amount of pain is 100% going to be there after all surgeries. We have so many strategies that we use to make sure that you will have less pain. We don't use tourniquet anymore, so there is no reactive histamine release. We will give you preemptive analgesia using pregabalin and paracetamol that will make sure that post-op pain is less catastrophic. After the surgery, you may be given certain blocks, certain special devices for anesthesia, such as infusion pumps, which will make sure that the pain is absolutely negligible. I have had a lot of patients tell me that they were afraid of surgery for no good reason. They didn't have any significant pain. And that is what we mean by painless TKR. So yes, bloodless, stitchless, painless TKR is a reality, but it don't take it at its face value. Coming to the closure of today's topic, knee replacement today is like a bitter pill. But it is a cost-effective and a definitely benefiting surgery in patients who are screened and who are operated in the right hands.